A big congratulations to the Toms River East Little League team for once again making it to the Little League World Series. And to the Robbinsville Little League team for making it to the Softball World Series. You all make New Jersey very proud. Welcome back to Jersey Matters. Hackensack Meridian Health's scientific laboratory in New Jersey is working right now on the COVID-19 virus. Jersey Matters' Jennifer Marin was at the lab and says they're working overtime on understanding the virus, its variants, and how to beat it. Jennifer.
Larry, researchers here at the Center for Discovery and Innovation are hard at work, and they tell me that in the last few weeks, more than 90% of the patient swabs are testing positive for the Delta variant. Researchers at the Center for Discovery and Innovation are working to better understand the Delta variant of COVID-19.
It's at least twice as infectious as the original virus that originated at the beginning of the pandemic in China. Consequently, it's considered to be almost as infectious as chickenpox.
The research lab is part of the Hackensack Meridian Hospital system. Elizabeth Titova, a clinical research coordinator at the CDI, is testing patient swabs to determine which variant is present. The Alpha or UK variant, which was once the dominant variant, is now barely being detected.
Delta is up and coming all over these swabs. We haven't tested these swabs specifically yet, but I'm almost sure that upwards of 90% of them will be Delta. So it is extremely prevalent.
Barry Kreisworth, one of the lead scientists at the research lab, says SARS-CoV-2, the virus that causes COVID-19, is constantly changing to survive.
What you have is now a virus that is able to find those unvaccinated and those children who are not vaccinated.
Kreisworth says there's only one way to overcome the Delta variant.
If you get vaccinated, we'll be able to reduce the number of the Delta variant and eventually just dilute it out. The problem is, as long as we have unvaccinated people and unfortunately children who are under the age to get vaccinated, we're still going to have places where the virus can go.
Still, studies have shown some breakthrough cases in which vaccinated people are contracting the variant.
The good news is that even in our breakthrough cases, most people are with very little serious illness and most of them go home.
He adds that vaccinated people who develop complications usually have underlying conditions, some of which they may not even know about.
The terrible part about COVID for the last 2 years is that a lot of people have not gotten routine examinations, routine physicals.
As for the alarming rise in COVID cases in children.
Children are unfortunately the victim in this case because they have no choice. We need to get as many adults vaccinated to dilute the chances of children getting infected.
In recent weeks, we've heard of yet another variant, Lambda. Scientists say it appears to be less transmittable than Delta, but there's another concern.
It's supposedly been shown in a few studies to be possibly more resistant to vaccines, so it would probably not be a good thing if it spread.
So far, only one Lambda sample has been collected at the CDI back in April. The leading scientist at the center says the next cause for concern is the flu season. He stresses that the flu and COVID-19 don't have a relationship and that it's important to receive both vaccines to be as protected as possible. For now, reporting in Nutley, for Jersey Matters, I'm Jennifer Marin.